reimbursement, as well as document your referral source related expenses in the Certify system. Once you go live on the system, you will then go directly to Certify to complete those 2 courses. So essentially, Certify is going to replace 2 systems with this current new system.
That's correct. And so the go-live date for the Florida sales team is February 28th. So every expense that is incurred on February 28th and forward will be done so in the Certify platform. Until then, so today would be your last day that you're using those systems that Amy just referenced. So if you click on the Certify homepage button, it brings you directly to the Certify platform. There should not be a need to log in. Your Certify credentials are your single sign-on username and password. That is going to be the same for the Certify application that will be on your mobile device. There should never be a need to reset your password. It's always and forever going to be your LHC username and password. So once you log into the system, you're going to see My Certify Wallet in the top left. This is where all of your expenses that are coming from your credit card, if you have a credit card, those are going to be automatically pushed to your Certify wallet. There's nothing needed on your part to get those expenses into your wallet. That's going to happen seamlessly every time you swipe. On the right, you have My Expense Reports, where your drafts, any expense reports that you're working on currently will be housed here. Any expense reports that are pending approval will be within this link. Anything that's pending payment, so something that has been approved by both your manager and by accounting, would be under the pending payment selection. And then lastly, there's the reports that are archived, so those that have already been paid. Towards the bottom left of the screen, you can see where you can find more information on how to add receipts, and we'll go over that in just a moment. So first, for My Certify Wallet, you can click More Items to see what's located within the wallet. And so here you can see that on the left side, anything with a credit card, the source is, anything with a credit card icon, the source is the credit card. So you can also add out-of-pocket expenses here, and that would just be missing the credit card icon. Anything with a receipt attached has a receipt icon, has a receipt attached to that expense line, and we'll show you how to add receipts in just a moment. We want to keep this Merge Items button up at the top right on in blue. That is going to allow any receipt that has a matching dollar amount, vendor, and date, transaction date, to automatically match to the credit card payment. So rather than you having to link individually each receipt to the expense, as long as you're uploading it and it has that appropriate amount and date on it, it should link to the appropriate expense. The icon up here where it says Show Details, if you click on it, it's going to show additional details about those expense lines. Okay, so there are 3 ways. If I go back to home, we have 3 ways to get a receipt into My Certify Wallet. If you click on any of these links, it's going to bring you here to show additional information. You can get receipts into your Certify Wallet very easily through your mobile device, and we'll show you how to do that with the tablet in just a moment. You can email anything from your LHC email to receipts@certify.com, and that email will send the receipt directly to your wallet for you to then link to your expense. And then lastly, you can upload a PDF, a JPEG, pictures, etc., from your computer to your wallet as well. So lots of options on how to get that into Certify. So next we're going to show you how to use the mobile app. For LHC group users, your Certify app should be pushed directly to your tablet through AirWatch. You have to be enrolled in AirWatch for that to happen. If you are aware that you do not have AirWatch within your tablet, let me know and we can get with IT to have you enrolled. If you are not an LHC device user, so if you don't have an LHC issued company device, it's your personal device, you will just download the Certify app to your mobile device. If any of you are having issues with that, you can reach out to me and we'll get you in touch with IT. So, and that should be pushed out to you tomorrow. So if tomorrow you log in and don't have the Certify mobile device, the Certify mobile app on your tablet, please reach out to me so we can get that resolved. So once you have the Certify mobile app on your device, you click on the app. It will prompt you for your username and password, which I said is your LHC sign-in. So we're going to click Add Receipt to add an additional receipt. You're always going to want to choose high resolution. And then you're just taking a picture of the receipt. So we're going to click OK. This button at the top right that says autofill, you want to go ahead and click that. It is going to try to read the receipt and populate for you. Okay, so you'll see that the date changed to February 11th, 2019, which is the transaction date on the receipt. That's what we're looking for. You want to make sure that that's correct because that's what Certify uses to match your receipt with the expense. The department is going to be the department that you are associated with. The category is something that you are going to select, and we're going to go over this in more detail, but it's the category that you're selecting to describe your expense. Specifically for Florida, because there are state-specific stark laws around expense allocations relating to NPIs, we have categories at the bottom of the drop-down specifically to you. They start with FL-, and so you will use those instead of just the typical categories that are located at the top of the drop-down. So if we choose Florida consumable drop-off, the amount populated for us, and we want to check to make sure that that's right, because again, that's what links to the expense. In the physician field, you want to type the NPI or the name of the physician or facility that you are dropping these items off to. This drop-down, or this search field is looking into the national NPI database. And so there's no need to have an NPI added. That is done in the background, and everyone that has an NPI is going to be within that database. So if I search for a physician that I know is there, it should pull up for me. I'm going to select it. Within the Certify app, you only have the ability to search and select for one physician NPI or facility NPI. You will have the ability to add additional NPIs to that expense within the Certify platform. This, we're going to say, is a credit card charge. If you were doing an out-of-pocket expense, if this is something that you paid cash for, you could select no, and it won't look for a associating credit card transaction. The vendor is Kroger. The location is going to be where the transaction actually occurred. So this was made in Elizabethtown, Kentucky. And then secondly, or lastly, you're going to add attendees or groups of attendees to this expense. We're going to show you later how to add attendees to a group so that if you're visiting a doctor's office or a physician group often, you can just select a group name rather than having to individually add attendees.
Remember, this is important because in the state of Florida, all other healthcare professionals, these are individuals that do not have NPIs, So that could be case managers, nurses, aides, anyone that works in healthcare other than MPI holders. They have a limit of no more than $50 per year as their Stark allowance. It's their baby Stark. So this is why we have to account for any other healthcare professional, and we would do that under the attendees list when we're allocating to the referral source or to the facility in Certify.
Okay, so if I click on Add Attendee, I can populate an attendee's information here. Click Add, and it will add that attendee within the attendees box. We want to give a reason for the receipt.
Remember that your reasons should be very similar to what you're currently documenting either in CRM or in your business courtesies log. We still need you to paint a clear clinical picture of the items that you're either dropping off or the in-services that you're providing, and the reason or the educational or clinical purpose behind the drop-off or in-service. So there is no exception. We're not changing up the description. You no longer need to include the receipt name or the full total amount because that's already provided for you within your Certify expense. But we still need to know if it was a consumable drop-off or an in-service or major life event item and the purpose behind it. So please be as descriptive as possible, not only for LHC group auditors, but for any auditor that comes outside that wants to look at your documentation. Remember, we have to paint that clear clinical picture of why we're providing these items to these referral sources at all times.
Okay, so after I populate my reason, we want to leave reimbursable yes. This is what determines that you are going to be reimbursed for this charge. For billable, we want to always leave that as no. We're not billing any of these expenses back to our clients, so you want to keep that as no. And you'll see that here, Certify is checking to see if this meets policy with the information it has. So we will click Save. And you'll see that the green bar is loading at the top. Syncing the receipt to your Certify wallet. Okay. So if I go to Receipts in Certify, I click on that, I'll find my Kroger receipt at the bottom of the screen. Okay, and I'm going to unmute all of you to make sure that you don't have any questions up until now. Let's see if I can do that. For any questions, you're all now unmuted.
Yes, is this videotape or recorded that we can watch this again in our free time?
Yes, ma'am, we're currently recording, and this is Natalie Person. I'm always going to be your point of contact for any questions relating to the onboarding of Certify. Annie Wills is here to answer any questions on the compliance side. But yes, we're recording this session, and we'll be posting that to iTrain subsequently and sending that out to all of you.
Wonderful, thank you.
Yes, and there are lots of supplemental material that we have, job aids, there are videos within Certify that show you how to do each of these individual things. We will be sending that out to the entire group so that you have the ability to learn at your leisure.
What's the app called? Certify.
It's called Certify. It's actually called Certify, yes. So you should be able to search for it within your app store and locate it and download it. If you have a personal device.
On my personal iPhone, I can find it, but when I looked on the company-issued Samsung, nothing's pulling up when I type in Certify.
Right. So the company-issued device, the Certify application should be pushed to you. There's no need to download anything. IT is actually going to push that out tomorrow morning.
Oh, okay. Easy enough.
When Go ahead.
Is this start on March 1st?
No, the go live date for your group for the Florida sales team is tomorrow. So any expenses that are incurred tomorrow, if you have a credit card and you swipe tomorrow, all of those credit card charges should be linked within Certify. You should find those there after they post. So you're probably not going to see those credit card charges tomorrow. You'll see them the following day. It usually takes 24 hours for the bank to settle the transaction, but you can start logging into Certify and start uploading receipts tomorrow.
Thank you.
But as you make a bank charge and you get your receipt in hand, you can go ahead on the mobile and take a picture of that receipt. Even though the expense hasn't hit your Certify wallet yet, you can still be proactive and take pictures of your receipts as you're going along. And then once the transaction goes into your My Certify wallet, that's when you can merge the receipt with the expense. So you can actively work your expenses throughout the month. I wouldn't wait till the very end to try and complete all of my expenses. So as you're accruing these receipts, go ahead and take a picture while you're out and about. This is why we're very excited to have this mobile piece, because we know you are out in the field. So take a picture, complete the first steps, and then once the expense migrates to your My Certify wallet, that's when you can merge the receipts and complete the expense. So you're essentially completing half the expense mobilely.
Now, when I was trying to follow along during the presentation, if I try to go to Certify right now off the home LHC, it says my account's not active yet. Is that to be normal?
That's right.
It won't go active
yes.
till tomorrow?
You will not have access until tomorrow.
Okay.
We wanted to prevent users from duplicating expenses in their current platform, Bank of America, Dynamics, et cetera, and Certify, so you will not have access to Certify until tomorrow.
Hey, we have like the sign-in sheets. We sometimes do lunches for, like an office of 20, and I saw y'all putting in each attendee. Do we have to put in like all 20 attendees into that, under that receipt, or can you just like upload the sign-in sheet?
You're actually going to do both. We need you to document every single person who's in attendance because, again, all other healthcare professionals in the state of Florida have their own $50 limits. So right now what our LHC group employees are doing in CRM, they have to document every single person. So we're going to mirror image what we're currently doing, and we have to track every single individual. So you're going to go in and put every single person that's on the sign-in sheet, and then Natalie will show you in a few moments how to create groups. So that way if you go see Dr. Jones, all of his staff's the same, you create the group one time, and then you can continuously use Dr. Jones' group to complete your expenses. And then you also will be attaching not only the receipt, but the sign-in sheet. So we have to have the physical documentation to back up what you're putting in your Certify expenses.
I have a question. On my Samsung phone, I have both the AirWatch Samsung, and then it's right next to it is AirWatch Telcom. What's the difference?
I'm not sure what the difference is, but as long as you have AirWatch on your company-issued device, your Certify app should be pushed to you. You don't need to do anything with AirWatch. It's just required to be on your device for IT to be able to push the application to your phone.
Okay, thank you.
Sure.
We're going to go ahead and mute the lines back so that way we can continue the presentation, and then we'll open the floors for any additional questions further along.
Okay, so you can do all of these things within the mobile device, but the platform looks very similar to this after you've gotten to the point where you're entering receipts. So we'll flip back to the desktop to show the remainder of the platform. So we're going to show you next how to create attendees and groups of attendees. So if you click on My Account here at the top right, it brings you to the screen. You scroll all the way to the bottom, and you see this Manage Attendees section. if you click on Add Attendees, you can individually begin to name attendees that you use often. So if I want to add myself here, click on Add Attendee. If you click on Next, it would only add the first attendee that you type. So if you're adding multiple attendees, you would click on Add New Attendee, and it's going to create an additional line. And in relationship, you're going to want to select if this is a client, customer, prospect, etc. And once you're done adding all of your attendee details, you will click Next. Okay. I am already in the system, so change that name. It's not going to let you add an attendee twice. So once you've added those attendees, you can click on Manage Attendees here. And this page is going to show every attendee that you've added to your account. You have the ability here to either add to you can use the drop-down to add to an existing group that you might already have. If you want to create a new group, then I'll show you how to do that as well. You can go back to My Account. Scroll all the way to the bottom. Under the attendees, there's also Add Groups. So you can create a new group that you can then add those attendees to. So and again, you can add multiple groups if you want to. So you hit Next, you click Manage Groups. And from this screen, you can see all of my groups here, and you can edit each one. So if we go to John's office, this is the one I just created, you'll see that there's 0 attendees. I've not assigned anyone yet. If you click on the pencil icon, from this screen, you can go and add individual users to this group. And you can see that attendees are allowed to be in multiple groups if you choose. So if I select a couple of attendees, and click Save, then I'll have a group named John's Office that I can use when I am entering in my expenses. Okay, so when you're entering in your expenses throughout the month, you want at the end of the month to create an expense report. And as Amy mentioned, you want to continue to add receipts to your Certify wallet, and you can certainly work on an expense report throughout the month, but you only want to submit one expense report at the end of the month. And the reason for that is that your manager is going to have to approve your expense report. That expense report then routes to accounting, and then accounting is paying that expense report. So the more expense reports that you submit, the more work that is required of your manager and accounting. And then additionally, that means you have to track the reimbursement that's coming back to you throughout the month rather than having that one reimbursement throughout the month. So we suggest continue to add receipts and expenses to an expense report that you're working on, but not actually submitting. So if we go to My Wallet, again, clicking on More Items at the bottom, you can either select all to add all of your expenses to a report, or if you want to pick and choose the receipts that or the expenses that you want included in the report, you can do that as well. So I'm just going to I'm going to pick a few to add. To my report, and then all the way at the bottom, once you select, you'll see this button, Add to Report. So I will click that. It's going to ask me if I want to create a new expense report or add these to an existing report. So if you were already working on an expense report, you could click this and select the expense report you're working on. For the purposes of the demonstration, I will just create a new one. You can name your expense report whatever you want. It's going to populate for you the transaction dates that are encompassed within the expenses that you selected. And you can click Next. Again, the icon to the top right allows you to hide or see details. When you're looking at the details, you can see this Bank of America information indicates that this is a credit card charge. Your vendor, your location, anything that you've already added to that expense. This was a receipt that we uploaded that we assigned to a physician, NPI. So all of those details are going to be there. You're also going to see, so this was not a good example because this, oh, okay. So Certify is also going to look for anything that's out of policy or a receipt not being selected. So in this situation, we don't have a receipt. We don't have a receipt assigned to this expense. So if I tried to submit for approval, it should not allow me to do that. So receipts are required for credit card expenses over $10 and all out-of-pocket expenses. So if we attempted to submit an expense report without that, it would not let me go any further. Let's see. Okay, so from here, these icons on the top left allow you to do a few things. So the drop-down arrow, from here, you could send this expense back to your wallet. So if for some reason this is a travel expense, for example, and I don't have this receipt yet, I'm waiting on a vendor to email it to me, I could send this receipt back to the wallet to save for an expense report next month. I could also add an additional physician here if I needed to, and Annie will go into more detail in a moment. The pencil, I click on the pencil icon relating to that expense. The details for that expense are going to populate here below. So at this point, I can add additional information here about this expense. I'm going to give it to Annie for her to talk about how we allocate specifically for NPI-related expenses.
Hey everyone, it's Annie in compliance. So as I said earlier, because you're in the state of Florida, your laws are more stringent than federal laws. So in that case, we have to follow state-specific laws, which means that any other healthcare professional other than someone that has an NPI number has their own baby Stark law of no more than $50 per year. So we have to track all expenditures given to anyone in healthcare. So that's down to the janitor or the receptionist in the office that partakes in either a drop-off or an in-service. So we have our expense, and we're going to be allocating to, we have already allocated, right? One. We have allocated to the one. So this is for a consumable drop-off. Remember that the categories, we're going to go in full detail of, So remember, for the categories for our Florida folks, your categories, since y'all are state-specific, are going to be at the bottom. So anything that you need for a referral source-related allocation in Certify, you're going to click on the category drop-down section, and you're going to scroll all the way down to the bottom. And anything that says FL-, that's going to be for you. So we're going to go into full detail of what each category means and the most frequently used categories. But for now, you're going to use Florida consumable drop-off. There's certain rules and behind-the-scene items that we need to make sure that we're tracking appropriately and staying up with the OIG, which is why you have to select Florida. So here's our allocation. I'm going to go ahead and save just so I can refresh to show you how to split an allocation. So you can buy in bulk. A lot of people do. We'll go to Kroger or Target, buy several items and divide it amongst our drop-offs, and that's fine. So what you'll initially do is allocate our expense to the first physician. In this example, we have our physician here, Dr. Albert Ellender. So to go ahead and make that split, there's the arrow next to the expense line. So here's the pencil where you would actually edit the expense, but right next to that is the arrow icon, which is Other Actions. When you click on the Other Actions icon, it's going to give you a few selections that you can choose from, and one of those right here in blue is Add Physicians. So this is where you can go and make additional splits to this expense. We'll go ahead and select Add Physicians. So you won't be doing any type of math or calculating, dividing it up. The system is actually going to be dividing the expense for you. So there's no math involved for you. So remember, the physician field is for any entity that has an NPI number. If they bill for Medicaid or Medicare services, they will have an NPI number. So for our facilities, physicians, physician assistants, or nurse practitioners, we're going to go ahead and you can put in their, it says right here you can put their last name, the organization name, or the NPI number. If you don't know their NPI number, you can certainly Google search for their NPI number, or you can look up in the NPInumberlookup.org website. That's basically what I use. So if you ever reach out to me and need assistance, that's basically the website I'm going to go to, or I'll try and Google search. Keep in mind for facilities, you have to, if you're looking for their name and their name is not populating, you have to find out what their legal business name is. So it goes by legal business entity. So you might know them as ABC Hospital, but their real name might be Jones Smith Enterprise. So just keep that in mind. So we'll go ahead and select the second drop-off, which is Dr. Kuzan, and we'll go ahead and click Add Physician. Down at the bottom where it says Selected Physicians and Organizations, you can now see that I have two separate NPI holders, so this would be considered two separate drop-offs. You can continue to add as many drop-offs, locations, or NPI physician offices as needed. And then once you have everyone that you're allocated or dropped off to, you just click Save. Once you click Save, you'll notice now that the receipt expense has been split. So here's the original expense line. We call this the parent line. So the parent line is going to be the top line, and if you notice the brackets that come down, you'll notice now it has some dotted line brackets. Every time you make an allocation, the expense is going to split. And it brackets off so that way you can see now that the expense has been split. You notice that the bottom line for Dr. Kuzan is $8.82, and the top line is $17.63. The reason for that is because the top line is taking an account of the attendees. So anytime you add attendees, the attendees across the board, so it could be attendees for, you might have 4 separate line items, and the attendees might belong to the third line item. The attendees, however, will always remain at the top parent line. So all of your information is calculating all of the attendees for the top line. But it will be splitting the expense equally behind the scenes, and when we run reports, it will show the true allocated amount. This is also true whenever you're taking a receipt and you need to add an image to add your sign-in sheet. It's not, the sign-in sheet and receipt will not be on the same expense line. It's going to be on 2 separate lines. Certify is not capable to add more than 1 image on an expense line. So what it's going to do is it's going to add the receipt to the parent line, and then underneath it is going to be a zeroed out dollar amount attached with a bracket. and it's going to have a 0 expense charge, but then it'll have the sign-in sheet attached. It's just how the system is. It's not capable of adding multiple images to one line, so they just break out the expense and add the image to the second line with a $0 amount.
Okay, so once you're done allocating your NPIs, everything looks good here. You can always add additional expenses that are in your wallet in the bottom right. So this is all, this all gives you the ability to add expenses at any point to your report rather than returning back to your home screen. And you would do the same thing if you were adding an out-of-pocket expense. So if this was an out-of-pocket expense, you could add it here. It would show up at the bottom. And you could just edit and start from scratch. So you could select a category, do everything that Annie just explained, select a physician, vendor. So the process is the same for an out-of-pocket expense. Once you are confident that you've got all of your information populated within your report, you can submit for approval. And again, if there's anything that does not meet policy, it would tell me that we have something to fix. You could also, so if I clicked on the pencil and added a receipt for this, so it says all credit card expenses above $10 out of pocket, I would just select a receipt here. Something to note, so the receipts that are grayed out, they've already been used within this expense report, but it does allow me to select that receipt again if you needed to use that receipt image more than once. And that could be the case if you're scanning in a couple of receipts on the same page, for example. You could use that page with 3 receipts on multiple line item of expenses, and it would work the same. So I can select a receipt, click Save. And I should be good to go. So if I submit for approval, click yes. Oh. Okay, so this one is, I think this bottom one, so this is a good example. So if you ever get a message or an error that says you've got to change something within your report, but you're not sure exactly where to go, you can click Cleanup Wizard, and it should direct you to the problem. So for this one, we're saying that it's an out-of-pocket expense. It is looking for a credit card charge because I have credit card charge yes. So if I select no, then it should no longer be looking for that credit card expense. Click Finish. I'm going to submit for approval again. Yes. It's asking me if I want to enter any comments. I can click Submit. And it's going to go off to my manager to approve. I'm going to unmute you at this point to see if you'll have any questions. Okay, you are unmuted. Does anyone have any questions at this point?
Natalie, what about? Joanne, I have a question. If you're doing a drop off to a independent living, and there is no NPI, how would you document that?
If they bill for Medicaid or Medicare, they will have an NPI number.
Right, but if they don't, they're
Reach out to
independent
any. So you're saying they only take private pay?
Right, like if they only took private pay, it's a senior apartment house or it's a group home and it's just all private pay.
Reach out to Annie Wilkes in compliance and I'll work with you on those one-offs.
Okay. Thank you.
The categories are going to dictate whether or not an allocation to an NPI is necessary. So for those, we just want to make sure that we're selecting the right category. And in general, we're going to go through, Annie's going to go through those category definitions in just a minute so that you'll understand, you know, which category we're selecting. It's very important to select the correct category because that drives their NPI tracking as well as financial reporting, how they're looking at expenses.
So like if I dropped off like a basket for a charity drive to a skilled nursing facility, you wouldn't require an NPI?
Well, that wouldn't be considered a drop-off. That would be considered under community beneficiary, and we're going to go over that. I'll show you the category of what you would choose. And then no NPI would be associated with that category that you would choose, and then you would need to allocate.
Okay.
Anyone else? Okay, I'm going to unmute you or mute you again, and we'll continue.
One side note I wanted to just make aware, whenever you're initially getting into Certify and you're looking for these NPI or physician or facilities, you're going to have to go in and search for them. Your little physician search bar is going to be blank. So you're going to have to get through that initial hurdle of finding all of your referral sources. Once you find your referral sources, Certify will remember who you have previously selected, and then they will remain in your drop-down box. So it's just going to be to get through the first initial allocation, so maybe your first expense report. You know, if you oftentimes see the same referral sources on a monthly basis, once you allocate to them the first time, if you look on the screen where Natalie has, these are all the physicians that we have allocated to, and they will remain in your history. So it's just to get through finding them first. And again, if you are struggling with locating an NPI number or facility or physician, please reach out to myself, Annie Wilkes, or anyone in compliance, and we'll be more than happy to help you locate that NPI holder. But again, once you have them selected and you allocate to them, that will remain in your history drop down, so that way you can use them. It'll be your most frequently used referral sources.
Right, so I'd only need to click find here if I didn't see my frequently used physician here. Okay, so after I submit my expense report and your manager is looking at and reviewing your expense report, they may have an additional question on an expense. They can send you an inquiry via Certify rather than having to reach out to you outside of the system. Another thing to note, you are going to get an email individually whenever a expense report is approved, disapproved, or rejected, or if you have an inquiry. So you're not having to log into Certify to see what activity is happening. You should be alerted via email. So if I click, I would get an email saying that I have an inquiry from my manager. If I go into Certify and click this inquiry box at the top right, any questions that my manager or the accounting team has would be here. So this inquiry came from the accounting team. I can open it up and it says, please attach sign-in sheet. So this is an expense that we submitted. We added attendees, so we should also have a sign-in sheet, and we can just do that by adding image. You can add a sign-in sheet using any of the three methods we talked about. Adding a receipt, you add attendee sheets the same way. So I can look for an attendee sheet here. We'll just pretend that this is a attendee sheet. Added attendee sheet. I can respond back to the manager or to the accounting team, submit reply, and it attached that sign-in sheet to my expense report. So they didn't have to send the expense report back. I was allowed to attach the sign-in sheet so that I can move on to approvals. Okay, so again, if I am working on an expense report, that expense report is going to be in drafts here. I can always pull it back up and add additional expenses to it. If I click on pending approval, I can see which expense reports are pending approval and where they are within the system. If it's pending payment, I would have my expense report name here. After it's been paid, that expense report will move to archived. If I open an expense report within archived, it doesn't show in this example because this is the test environment and it hasn't actually been paid, but if it was my expense report and it had been paid, here under summary, I would see either an ACH number or a check number and a date indicating when and how my check was paid or my reimbursement was made. You can also see to the right all of the approval history. So at any point in any of those categories pending, you can see how your expense report is moving to the system. So this eliminates the need to continually ping accounts payable to know where your expense report reimbursement is in the process. You should be able to have visibility to that here. Also, if you want to click print report from this page, this gives you some additional information. If you scroll down, I mean, again, we have our approval history, but you'll also see kind of how you're trending with your expense categories, which is helpful to see. And your manager has the ability to see those things by user as well. For support, so that's really it for the Certify application. For support, again, myself, Natalie, I'm the project manager, and so I'm going to be able to answer any questions in terms of onboarding, or we'll hunt down the answer for you if I can't answer the question. Annie is going to be answering any questions specifically related to NPI allocations and compliance. Once you are up and running on Certify, if you have an issue, whether that is about a specific expense report, about compliance, about not being able to access the application on your device, doesn't matter what the issue is, we can submit a support ticket. So we're working on getting a Certify link. So if you go to Service Desk at the bottom to enter a support ticket, click on that. We're working on getting a Certify link at the top of the page with IS Help. It's not there currently. You'll have to go to Full Service Desk site. If you click on that, go to Service Catalog, and you will see Certify in the drop-down. Certify Expense Support. So if I click on this, I'll have the ability to enter in a support ticket describing your issue. This category selection is what will route your support request to the appropriate party. So if you're selecting NPI, it's going to route to the compliance team. If it's an application error, it's going to route to IT for them to resolve. If it's you're having an issue with a specific expense report or an inquiry on that, it'll route to the accounting team. And then you'll just click Add Request. So the last thing that we want to discuss is just the expense report timeline. This has not changed. This is the timeline that you're dealing with currently, so it's more of a reminder. We need all expense reports approved by your manager by the 5th of the month, and that is to allow for accounting to review and approve each expense report and get you your reimbursement by the time your credit card statement is due. So please submit your expense reports within Certify in enough time for your manager to approve that by the 5th of the month. On the following check run, you can expect that accounting will have reviewed and approved that expense report. A payment should be issued to you, and then at that point, your payment status should be updated in Certify, so you would be able to log in and see that there's payment information on that expense report. And then, of course, you'll be reimbursed for you to be able to make the payment on your credit card. Something to note, today, for most of you, the NPI allocation is due after the expense report today. As we've explained, that is inherently happening within the Certify application, so that timeline is also by the 5th of the month. So Annie is going to discuss in additional detail the additional expense categories that you're not necessarily using today, but will be using within the Certify platform.
You are looking at the categories. Remember, your categories will have F, L in front, and that they are at the bottom of the drop-down selection. Please do not choose the regular categories. You're going to be choosing, it's going to have F, L next to the categories that you need, and they're located at the bottom of the drop-down selection. So the first one is Appreciation Week or Day Food for Referral Sources. So for appreciation days or weeks, the first one is food items. If you're giving food items for, let's say, Nurses Week or Doctor's Day, you would select food. If you're providing a plant or flower for Nurses Week or Doctor's Day, Social Worker Month, or it could be for Christmas or Hanukkah. Those are the two holidays that we recognize. Remember that the items cannot exceed more than $30 per physician office or hospital department or floor. And that you make sure that you select the Florida appreciation. Depending on if it's food, you need to select the food, or if it's plant or flower, select. The reason why we have to specify if it's food or plant, that is for financial reporting purposes. Moving on to charitable contribution, we're going to select the Florida. This is if you're sponsoring a charitable golf tournament or a table at a charitable dinner. Before you make such a donation, remember that you have to receive prior written approval by both your sales divisional president and our chief compliance officer, Joanne Little, because we have to identify and make sure that the organization is a true 501c3 nonprofit organization before you can do such a donation. And once you are approved and you make such donation or sponsorship, then you would select the Florida charitable contribution. Next is community or beneficiary. Remember, you're going to select the Florida community or beneficiary. This would be if you're dropping off bingo prizes or doing monthly birthday cakes at an ALF or a nursing home. This would be if for Veterans Day you gave out Veterans Day pins or individual flags to veterans. This would be if you're doing a community health fair where there's only community. This can be current or potential beneficiaries. Remember that you should never exceed more than $15 per person per day and no more than $75 to that same beneficiary in a full calendar year. Remember that anyone at any time could need services provided by LAC Group, so we consider anyone in the community a current or potential beneficiary. So for that cases, we would choose the community/beneficiary expense line. Next is consumable drop-off. Remember that you're going to select the Florida consumable drop-off. Drop-offs should always be of consumable, edible items. Anything that can be consumed, it's really the law states anything consumable within that time frame. So it shouldn't be any like frozen meals or dinners where you can stick away and they can keep for a later time and date. It should be within the parameters of that drop-off or within that time frame. You are allowed to provide containers. So let's say if you're buying in bulk candy and you wanted to buy a little container to put your candy in, that is fine. Remember that the containers should be no more than $1 or $2 each. I know a lot of times you will go out to your local Dollar Tree or dollar store and provide containers. That is fine. As long, the takeaway is as long as the container isn't the main focal point of the item, it's just a container to put the consumable item in, you would consider that a consumable drop-off. Remember, we do have to allocate the containers as well. Drop-off should never exceed more than $30 per physician office. Even if there's multiple physicians within the office, if they share the same staff, you're still limited to that $30. However, you can split that expense line and you can allocate to both of the NPI, so that way they can both receive a portion of the drop-off, but you're still limited to that $30 expense. And remember that anyone in the office that receives a portion of the drop-off must be tracked under the attendees. For continuing education credits, this is if you're doing like a CE event or a CEU, you would choose this event. Remember that the fair market values of the credits must be identified by the education department. You can work with either our compliance team or education to find out the fair market value of the credits, because we have to track those. And if you provide such meal at the event, remember that it's no more than $30 per person. If other healthcare professionals are in attendance, then that amount drops to $10 because you're in the state of Florida, and we also would track that as well. Educational in-services, this would be if you're doing a sit-down lunch and learn. Remember that it should be in a setting conducive to information exchange, which means you should never do it in a noisy restaurant or bar. It needs to be in a classroom type setting. Make sure that you get that sign-in sheet. You are still required to submit your sign-in sheet along with accounting for all the attendees present in Certify. You would select the educational in-service or luncheon. Major life events, as appreciation days or weeks, is broken out by food item or plant or flower. So major life events, this would be if a referral source is having a birthday, a wedding, they had a death or birth in the family, retirement. Remember that it's no more than $75 per event or major life event, and this should be only offered on an occasional basis. So we're saying once or twice a year per referral source. So if they got married and had a birthday within 2-month time frame, take one opportunity to recognize both events. You shouldn't buy them a $75 gift for their birthday and then a month and a half later buy them another $75 gift for a wedding. Pick one time to recognize both events. Remember that it's no more than $75, so you could get a very nice flower arrangement for $75. That does not include delivery. That just includes the item and tax. And you would document under major life event. Promotional items. This would be if you are going outside of the company branded store, Brand Central. So we do have a company branded store, Brand Central. Anything that's purchased from Brand Central, we call that marketing collateral, and that means that you don't have to allocate to a referral source. So we call them kind of like freebies. So you wouldn't have to track these in CRM, in Certify. You would only do this for anything that you purchase outside of the Brand Central system. So if you went to Target or Walmart and purchase promotional items, remember that your promotional items must coincide with your educational or clinical program that you're promoting. So if it's heart health, it needs to go along with heart health. If you're doing flu and you want to do hygiene, hand washing, and go out and buy hand sanitizer, gloves, maybe tissue, make little packets and give to all the case managers just to promote hygiene, hand washing to prevent the spread of flu, you would have to make sure that it's no more than $10 each per item and that it is tracked under promotional items. So if you ever have any questions regarding those categories, you can reach out to compliance and we'll be more than happy to clarify any of those categories for you.
Okay, so to summarize, we just want to draw attention to some important reminders. So first, picking the correct category, as Annie just described, is very important because this impacts financial reporting and tracking of expenses by NPI. Secondly, receipts are required for all expenses except for credit card transactions under $10. Certify will allow you to submit an expense report with expenses that do not have a receipt for under $10, specifically for credit card transactions. All out-of-pocket expenses require a receipt attached. Third, in order to allow enough time for reimbursement for AP to reimburse you prior to that credit card payment due date, managers must have your expenses and approve them by the 5th of the month or the Friday, and I forgot to mention this earlier. If the 5th of the month falls on a weekend, then they need to approve that expense report by the Friday before in order to get reimbursement before your credit card payment is due. You can continue to submit expenses beyond that 5th due date or include it on the next expense report. We just can't guarantee that that reimbursement is going to happen prior to the credit card being due. And ultimately, we want you to have that reimbursement in your bank before the bank statement is due. Fourth, your certified username and password is your LHC single sign-on, the same username and password that you're using for your computer. So do not reset your password on the application. You should not be prompted for a password on your desktop. I have found that if you're using the application and you allow it to time out, then it will prompt you to log back in. You can go back to your home page and re-click on that Certify button, or you can put in your LHC username and password. But from the home page, it does not require a username and password. It will prompt you for a username and password from the device, from your tablet or mobile device. Lastly, so tomorrow, February 28th, is the effective date for the Florida sales team. So any expenses that you incur on your credit card starting tomorrow will be put into Certify, or any out-of-pocket expenses that you have starting tomorrow will be put into Certify as well. So your contacts, at least initially, I'm Natalie Person, the project manager, so I will point you in the right direction if I can't answer your question. I am happy to help with anything relating to the onboarding process, and Annie Wiltz is your contact within compliance relating to NPI-related issues. You can reach out to either one of us, and we will get your questions answered. Lastly, there are lots of supplemental material that are going to be available to you, and we will email this to you directly. It is also attached to the course that this WebEx is attached to, so you should be at least prompted to open these things. There are lots of videos, job aids, et cetera, within these documents that will help you if we can't answer the question, or if you don't want to reach out to us first. And lastly, the business courtesies to referral sources is a policy relating to sales-like expenses. So I will unmute all of you so that you can ask any questions that you have before we wrap up.
Yeah, I may have missed it in the beginning. When you say get approval from our managers like we do now, is that something separate than what's on Certify? When we hit submit, does it go to our manager, or do how do you send it to your manager for approval first? Maybe I missed that during this presentation.
Yes, as soon as you click submit, this is going to, on your expense report, it routes directly to your manager. So there's nothing needed on your end other than to click submit. If your manager has questions, they're going to send those questions back to you via your via the inquiry link that we showed, and I'll share my screen again so you can see what I'm talking about.
Also, you'll be getting emails throughout the course. So your manager will get an email notifying that you submitted a report. They can click the link, go in, review your expenses, and approve. If they have an inquiry, they can send it to you. I believe you will get an email about it. Click the link, inquiry, and complete or edit or modify any issues identified. So you will be getting emails throughout the course of the process. So it's really good because right now Bank of America doesn't prompt emails. Your manager basically has to go in blindly, or you have to track you down. You have to email your manager. The system's going to do that for you automatically. So that's a good thing.
So right now I resolved the one inquiry we have. So the top right box with the inquiry link went away after we resolved the inquiry, but if you have a question from your manager, it's going to appear at the top right of your home screen within Certify. So yes, when you submit your expense report, it's going to go directly to your manager. Your manager is going to approve or reject. If they approve, it moves on to accounting for them to then approve the expense report and pay it.
Okay, great. So when they approve it, it just automatically goes on to accounting.
That's correct.
All right, thank you.
Yes, sir. Anyone else?
Can you hear me?
Yep, I can.
Can you just review again how to download or take a picture of your sign-in sheet?
So you can do that the same way that you do a receipt. So if you scan your sign-in sheet to your computer, you can upload it here or email it to receipts@certify.com, and it's going to go into your wallet. Or you can take a picture on your device like we showed before, and I can re-pull that up. So it's going to be, it's the same situation. So you can click add receipt and actually click high resolution and take a, if this was a sign-in sheet, you would just take a picture. Click OK. And it should allow you to save. And then once you save and it updates, it's going to be within your receipts and Certify. For you to then use and attach. Did I answer your question?
Yes.
Once you have a receipt attached, you can click on the edit button and it'll allow you to add images, and that's when you'll go in and add your sign-in sheet. And remember, it's going to go on the separate expense line or the second expense line, because remember, Certify cannot link more than one image per expense line, so it will drop it down to the second expense line. If you only have one single allocation for that expense, for that receipt, it will create a second expense line for the sign-in sheet. However, the dollar amount will be zero. It just creates a second expense line. It'll show a $0 amount. That's just a placeholder to allow that sign-in sheet to be merged to the original expense line.
So if you go to your expense within your expense report and you click this arrow for other actions, you'll see add image. This add image link is only going to be available to click if you have a receipt attached. So it requires that you attach your receipt first, but then after you attach your receipt, you can go and add image, and it'll allow you to attach that sign-in sheet. So if we have if we have this as our sign-in sheet, we can select it to use this image. And it should add this zero line item that Annie was just referencing.
So it brackets out the expense. It gives it a zero amount. However, it adds the sign-in sheet image. And you will notice to the left of the pencil, it is bracket. So that shows you that those expense lines they correlate together.
And all the details here are going to be from the parent expense. This doesn't apply to the sign-in sheet, obviously. It's just the 0 is what's going to indicate that that's just an additional image. Any other questions? Okay, well, thank you all so much for joining. Again, Natalie Person is the project manager. If you need to reach out to me, or Annie Wiltz if you have questions on compliance. Thank you all so much and have a great day.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Have a good day.